Great question about Lichen Planus, or LP. Please do not pronounce it Lichen Planus or Lichen Plantus. It's Lichen Planus. You have heard about eczema and psoriasis as these very common autoimmune skin conditions. Well, Lichen Planus is probably the third most common autoimmune skin condition you just don't hear about. So Lichen Planus usually is caused by some unknown trigger. Classically in the textbooks, it can be associated with hepatitis C or some medications, but in general, patients develop these purple polygonal papules and plaques on the volar wrists, maybe the lumbosacral area, sometimes on the trunk, and even on the shins or instep of the feet. And these purple polygonal papules are crazy itchy. And if you look closely at them, they'll have these little white lacy lines on top of those papules and plaques called Wickham's striae. It does like the mucous membrane sometimes, like the oral Lichen Planus, you can find it in the private area too. They get the same Wickham striae, those white crisscross lines on their buccal mucosa or on their gingiva, their gums, and then it can erode and be very painful, preventing them from eating the foods they want to eat. There is no FDA-approved treatment for Lichen Planus, but we know what to do. It's just hard to get the medicines approved. Sometimes if they have oral Lichen Planus, try oral metronidazole, 500 milligrams twice a day. If they have cutaneous LP, we certainly start with topical steroids, but things like hydroxychloroquine, methotrexate, and even some of the psoriasis biologics can be quite helpful, but we're waiting for an FDA approval for some medicine to treat Lichen Planus, which we see quite often in the dermatology clinic.